Welcome back, Veterinarians Unmuzzled, and we are making a beverage today with you guys. So this is going to be a Sazerac. This is something you had in New Orleans.
Yeah, I actually had a version of a Sazerac.
Yeah.
But...
I'm Denise. This is Dr. Doug Tucker and Dr. Bill Cordius, and we're just doing this. We're just doing this together today.
We're just doing it.
We're doing it. It's kind of.
There will be an educated conversation about veterinary medicine. However, we're focused on a beverage today, right now. We're going to do this, and then we're going to have a chat. Let's do it.
And it's kind of the classic Sazerac that's with cognac rather than...
So he was telling me a very interesting thing about this drink, that this is one of the first cocktails, right?
Yes, yeah.
Okay, so very first cocktail.
Like with authority. With
maybe
authority.
the last.
There might be a little cork in each of our drinks.
So we've lined the glass with absinthe.
Wormwood.
So we're going to wormwood
like
absinthe.
the legit absinthe.
This is, this could go either way.
Although I think that's a myth with the green fairy and stuff.
This is everything we're using there.
It's more
so,
probably people just getting...
Screenshot, feel free.
Too much alcohol, blaming it on the absinthe.
Yeah.
I love that.
Yeah.
Okay, I'm all in.
We got to taste it. We got to try it.
So let's give it a gander. Let's see what we got.
I think. Prost.
Prost. Ooh, it smells delicious.
Ooh, that's good. That's tasty.
We did break from tradition real quick. Rather than using Sazerac cognac, as it was not readily available, this is an excellent cognac. This is Pierre Ferrand Reserve. It's a good bottle of cognac.
Very nice.
Wormwood absinthe. We did use basically sugar cube concept of simple syrup and Pashad's bitters, a few shakes, lemon rind, which was twisted into the drink, but to avoid sacrilege, has not been placed in the drink or even on the rim of the glass.
Oh, wow. Okay.
Very good.
All right.
Very good.
So
I love that.
So
now this is a beverage you recently had that you wanted us to try with you, right?
I've had a number of Sazeracs, but I had a twist on a Sazerac called a Quackerac. That was actually a duck fat washed whiskey, rye whiskey, I believe. And it was like this whole thing about like washing the whiskey and fat is a thing, and it's supposed to make it more silky. And it was interesting.
It was
interesting.
Really nice.
But
it was a pretty drink.
Yeah, it was a pretty drink. It was a good drink. It was interesting. I'm gonna do a little riff on that the next episode.
Yeah,
I think.
we should do that.
Because
I'm
I'm
interested
gonna
in
try
trying
it. We're gonna try to do that myself.
Okay.
all right, man.
Good. I like that.
All right.
I like that.
So what's the topic of conversation?
Once again, I'm Denise, Dr. Tucker, Dr. Bill Cordius, and Veterinarians Unmuzzled. And today's topic is the vet-centric
types of veterinarians that one of the things that's discussed is the types of veterinarians.
Correct.
And they are
vet-centric, client-centric, and patient-centric.
Patient or pet-centric.
Pet-centric.
Yeah. Animal-centric, I guess you say too.
I'm going to go one step further than that. And I would say, although those tend to be veterinarians, I'm going to say that tends to be kind of the practice as a whole, the entity, if you will.
Sure. Because
the belief of the practice, whoever's responsible for
you
taking
can
it on.
have a larger practice that might have different like you might have a doctor that's very vet-centric as well as a client. You can blend that because I was a client-centric vet and I worked in a vet-centric practice with you.
Hard to believe knowing you.
So, what? I'm client-centric right now.
He's eccentric and client-centric.
I'm client-centric now.
I mean, okay. I guess it's.
I'm very client-centric. Like, and that's the whole. Hey, this is why we're having the conversation.
Yeah. Is it to a T or to a fault?
It depends on the cases. Sometimes there are times where it has been to a fault. I think.
Okay. I take that back then. Yes, because sometimes you are very patient-centric.
No,
it's depending on the case.
I'm going to disagree.
That's why I'm saying it. I take it back because I think it's depending on the case.
I'm very client-centric. I'm client-centric to a fault sometimes. Like Because I blend. I try and think about what the client wants, how they perceive their pet, how they perceive this whole interaction, and what they want from it. And then I try to apply that to the pet's care. And that, like I said, like sometimes that is I go more too much to the client, and sometimes don't do everything I can for the pet. And that's often dictated by financial constraints. It also can be like the personal philosophical views of that particular client and their pet that I I end up constraining myself on what I could potentially do for that
We've
case.
had moments. We've had moments.
Well, let me first, I do want to interject here and say, I just want to do a brief explanation, you know.
Yeah, let's talk about the
So,
different types.
all right, so we'll kind of go down the gamut here. We got client-centric, we've got vet-centric, we've got pet-centric. A vet-centric practice or veterinarian is going to be one that's really all about really making sure that everything works within the confines of the veterinarian, whether that's, you know, we only see appointments to whatever hour.
Probably closest to what human medicine is. Actually.
Possibly, you know, I'd hope not, but possibly. But
No,
yeah, let's
it
be
is.
honest.
It
It
is.
is. Okay, it is. It is. You know, my hours are my hours. I don't stay late. When I'm not around the practice, I am not going to do anything about a case or anything like that. It's really all about what I want to do, whether that's the way I want to.
You're going to do what the doctor's trained to do, what they want to do. In every case,
Not for
like no matter what the financial burdens are, no matter what the client thinking is about the pet and where they are at, which works great when you have a particular type of pet owner that is very anthropomorphic with their pet and has a lot of financial means. Then it works beautifully because then they get everything they want. Very similar to what is going on in human medicine, you can go, the sky's the limit in your care to the extreme, which can solve cases, which can actually be beneficial for the pet in the long run as well.
So yeah, and so it's kind of a little bit of the my way or the highway type of approach.
Yeah.
As a veterinarian, this is what we're going to do. Period.
This is our
So-
clinic standard. You know, we're unlikely to deviate, if at all.
Based on our protocols, our hours, what we
Established
wanna do.
protocols, established standards of care
Yeah, let's
that are very
Let
rigid.
him finish the rest of it.
And
So that
look,
we can
you know,
get through them all.
and look, at the end of the day, it is a little similar, but it is different from pet-centric. Pet-centric is really focusing on the patient, the animal patient only. What is every single thing that I truly believe this patient needs, and I really want to focus on that. I really want to try to minimize what either A, the practice or my profession is telling me I need to do. I'm going to do is specifically, absolutely what I need to do for the patient, or B, even what the client wants. The client might not want all of that, but that's
Which you would
not what
think
I'm
would be the way to
considering.
do it, but it's not because
It's not, unfortunately, because
not
we do have
necessarily
constraints.
not necessarily unfortunate. but-
Fortunately, unfortunately.
yeah,
Maybe, yeah.
because you basically you
go
base it
your way
on the behavior of the pet as well.
Yeah.
Okay, because you're somewhat limited by what they'll allow you to do.
Financial.
That's the client that comes in the client centric
But there's
stuff.
also a limit on
But
what you
there
do
is a
based on
limit,
financial.
and therefore your patient care for the pet is sometimes
Is limited. Mm-hmm.
constrained. But what's best for the patient, not necessarily as an individual, but what is their quality of life like going to be? Like you can think, I know I can do this for this animal, but maybe it's not for the best interest of the pet because maybe they're in pain while this is going on, or maybe this is. The end result is not a significant length of time, for what we're actually having to do to gather the information or treat the disease, right? And so, example would be like a cancer would be the best example, right? That you can go do chemotherapy, radiation, cut it out, and you buy 3 months of time after recovery. Let's say you have 3 months of suffering to get to that, and you have 3 months before it recurs. Is that fair for the pet? Is that fair to them? Is it fair to the client? And that becomes client-centric as well. But that's, you've got to think about kind of what's good for that individual animal, which is hard to kind of put yourself into all the time and know without a relationship. That's why it's important as a client, as a pet owner, to have a good relationship with your vet, so they really understand your pet's behavior.
Yeah.
And we get to know your
makes it
pet to the
comfortable
point
to
where
have the
we can
conversation.
be so much more helpful
Yeah.
over years of experience, not 1 or 2 visits. You can't just pop into a vet, expect them to completely understand all the nuances of the dynamics, and you're going to get a rosy solution all the time.
Which makes second opinions kind of scary for me because depending on where they come from, it's like
Yeah,
my doctor's way
Yeah,
It's gonna be
you don't
every
know-
second
you don't know-
opinion.
you get
It's
second
good to
opinion.
have it, but it's like,
And then,
whoa.
is it a vet-centric vet? Is it a client-centric vet?
Exactly, you
Is it
don't
a
know
pet
where they
centric?
came from.
You can usually get the gist of it.
I think that some of your point is that, and I think part of that patient-centric or pet-centric part of it too is and there's other parts to it. It's not just what's absolute best medicine, regardless of cost or effort put into it for that patient. But also the other end of it is at some point in time, it's not best for that patient to, for lack of a better term, drag them through the mud in an effort to, fulfill some type of medical prophecy of what we should do for them,
Right.
And
You have you have to think about how they're going to suffer. Like,
What's the
let's
quality of
say,
life?
like everything we do for that animal that comes into that practice is a degree of suffering. That just coming to the practice for a lot of pets is stressful. Doing the things we need to do to, administer medications, rather diagnose tests is stressful, sometimes painful, hopefully minimally, or we do things to make it less painful. And so, and to get to a point of time where we can create quality of life for an extended period of time after whatever the disease process is, hopefully for cure or management.
Yeah, I think it's also one of those things is you probably come up on this, and sometimes I imbue this into my conversations with clients is it's not so much a matter of could we, it's a matter of should we.
Sure.
Should we? I mean, could we do things to increase the longevity of life with a certain treatment? Yes, but should we? Well, probably not if we're only talking about maybe a couple of months and a tremendous amount of suffering and expense just to get a couple of months. Could we? Should we? And I think you'd agree with that.
I agree, which brings us to the other type of vet, which is the client-centric vet, which we both tend to be, I think, is the client-centric.
Doug apparently more than me, but very much so.
More than you. I don't know if I'm more than you. I think I tend to follow what. I mean, I've been in situations where a client is like, I just want you to do what you would do, and I'm like, okay, so you're giving that up to me. Like it's almost like letting a vampire into the house. Okay, you give it up to me, now I'll do what I want to do. The client-centric veterinarian tends to go with how the client thinks, because believe it or not all of you guys think the same. Like some of y'all think of pets as your babies, this is part of your household, which
Very much.
And
It's okay.
and
It's
you
okay to
will
be that
do
patient.
and absolutely.
It's okay.
And we anthropomorphize their care to the point that you expect a human level of care, which then I'll provide. Versus another client that tends to be, they love their pet. They might really care about their pet, but at the same time, they don't want to do extreme things to their pet that cause pain and suffering and without increased quality of life at the end. And then you have another type of client, which we can have a whole conversation about the types of clients, but the client that really, the animal is a tool. The animal serves a purpose, but they're not going to want to invest a lot of time and money into figuring out what's wrong or treating a process that is not really pretty simple and pretty easy to do on their part. And so you have to flex to those different types of people with every case. And as you gain a relationship with a client, you start to learn which of those people you have, and you morph for that reason. And I find that to be the best way to get what I need done, to be that way.
To be vet-centric, I'm just picking at you.
You're very charismatic, though. You can
But you're taking the
definitely be
client into account.
Thank you.
You
I try to have a good rapport.
Easing them into your idea. And I think a lot of it is full transparency. You give a lot of information.
I give a lot of information so we can make good decisions, and they can help make the decision. And I like them to ultimately make the decision. I try to provide them information best to make the decision for themselves and their pet.
Coming to that
And hopefully we come to this golden triangle of vet, patient, client, all come together in the perfect harmony. Doesn't always work, but that's always the goal.
Yeah, I think that's kind of the hard part is trying to figure out exactly how far people want to go and everything.
Yep.
And also, what are your morals and all? I mean, at some point in this, you have some people that come in that, quite honestly, the pet is a very minimal part of the life. They're only there to enhance the owner's part of life, which I get and I understand. But beyond doing much of
Try not to judge.
Right,
It's the
try not to
client-centric
judge.
vet
But as a
doesn't put
veterinarian, right.
judgment
But as a
on the
veterinarian, you have to-
situation either.
But you have to figure out, where do you want to lie as a veterinarian? Personally,
The vet-centric, the vet-centric pet-centric that will tend to judge you based on how you think about your pet.
That's part of that. And then, but you have to decide too, because part of that all, as these factor in together, comes down to sometimes you have people come in and say, "Hey, look, I know you've never seen me before, but hey, Spot's 14 years old. He's just old. He doesn't get around much. We never really had to do anything other than his shots before. We think it's time for Spot, and we would just want to put him to sleep." For me, it's a no. That's a very big decision. We're talking about ending a life. For me, that's a big deal, okay? And, I'm one of those people that I am not going to be client-centric to the point where I'm going to say, not a problem, that's what you want, that's what I'll do. I am, at that point, going to put in some of my pet and vet-centric part of that, which is going to say, for me to fulfill what I feel is the right thing to do.
What if they're defecating the house and urinating in the house and they can't get up?
Well, I still want to find out, is there reasonable...
So you want to do a physical exam. You want to establish the relationship, which is appropriate.
Yeah, I mean, we're there for the patient.
Back to our last episode, the thinking doctor, because he's a thinking doctor.
Right.
So he wants to think about those things.
Figure out those things, but sometimes you end up in situations where that client's not really the client for you. We have that person who says, look, our dog's just old, and I don't want to get into any of this. I know what I know. He's my pet. I'm done. And I have no problem saying those folks without any animosity whatsoever. That's your decision. I'm not comfortable with it, but I promise you, you can go up or down the street and somebody will put your pet to sleep for you. I at least got to figure out, is there something reasonable, and that's what I'm after, is reasonable that we could do for that dog that might be pooping and peeing all over the house. Is there something we could do? Yeah, we need an exam, and we might possibly need at least some level of lab work or some tests to do to figure out if there's something that we can reasonably treat. Beyond that, though, that's kind of where my limitations lie versus the pure, I think, client-centric, and I know you're client-centric, but not so pure. When somebody walks in the door and says, hey, look, time to put Sparky to sleep, let's do it, you're probably not going to say, okay, let's do it.
Yeah.
We're going to want to know, you and I know us both well enough to know why, what's going on.
It's important to have a kind of a general, you have to communicate and understand where that's coming from. And sometimes there'll be enough information to come to that conclusion that this is or physical exam and the patient is skeletal and not able to get up, and you're like, yeah, I agree, it's time. I mean, you have to have that consultation and a discussion so that it all comes together. Once again, coming to the perfect
it's harder to do when it's a new client.
Client, pet, patient, vet, client, patient, into this little golden ball of yes, this is all good. We're all on the
star
same
of the
page.
pyramid.
This is the right decision.
As a new client, though, I will say it's harder to get there. Sight unseen, very first time coming in.
Hence again, while it's good to have a relationship with your veterinarian, establish a relationship with a veterinarian so you know them.
It makes your life, it makes everyone's life very easy.
Absolutely. I mean, it is one of those difficult situations. I think, look, we're becoming the profession of, we're topping the pyramid for suicides and depression and all.
Oh, geez, that sounds like an episode.
Well, it's another episode, but that's our profession is shrinking because people are just not wanting to get into this field, and part of that has to do with some of what we call convenience
and
euthanasias.
That is one of the reasons why, at least for my personality, I became more client-centric in how I think and how I change how I practice based on. It made me feel better about all the decisions being made because the client is ultimately driving. You guys, the client, in my worldview, are driving or helping or assisting in the decision process. I'm just letting you make all decisions. I'm not going to follow. But we are talking together and we're coming to a conclusion that works best for you. And so to me, that has made me happy. I mean, I can get, if I was a veterinarian and I was just I need to do this by the book all the time. And I have so many people that push back and don't want to do the things that I've been told I need to do. That's going to be a hard way to live in practice, to be so rigid in that. And and people, particularly if you end up in a certain area, a certain clinic where you have clients that are run the gamut of types of clients and you can't flex to that and you are just constantly not being able to do what you think is right. that would be incredibly stressful. I have no stress in that regard because of that. And that's helped me practice and be.
Yeah, and you're gifted beyond me. I do have some stress with that, It comes down to, well, what happens when that person who hasn't had their dog or cat see a vet in 5-7 years, and they show up at your doorstep, Doc, I want to put it to sleep. I am not doing lab work. I really don't want an exam. I'm here to put the pet to sleep, period. For me, that's not my comfort level. And I have no problem telling people, honestly, again, you could go up or down the street, somebody will do it for you. That's not my comfort.
So the way I look at that.
But hold on. Here with me. Bear with me now.
I'm only going to forget what I want to say.
No. Well, keep thinking it over.
Really
You're interrupting me when I'm saying that's not my level of comfort and everything, And yeah, some of it goes to what is best for the pet. I mean, when that pet's there physically suffering, I think that is part of the problem and that we face as a profession. I mean, trying to deal with what happens when you have the pet who comes in and has the owner that they haven't done anything for that pet's health care for, God, maybe 5 or 10 years, and all of a sudden, hey, put them to sleep.
We rarely get in that situation with it in the clinics we work at. It happens, but it's rare.
It's uncommon, but it happens.
We're usually, and we can have this conversation.
So the question is,
we're in a demographic situation where we don't really see that very often.
So the question is, though, when that does happen, what do you do?
Well, I think that's really kind of a moral issue at this point, and I hate saying that, but I know you have a point. I know you have a point. I get it. But it's like, if they're not going to take care of this animal, do you just say, if they're going to go up the street and to put it down anyway? At what point do we just say, you know what?
Yeah,
it's going to happen no matter what.
God, I can't come with these things.
Was my patient, and we know this owner's not compliant. They're not going to do it anyway, no matter what. So should we just go ahead and put the cat down?
I worked with the vet.
There it is.
I worked with a vet. Who's a great guy, great vet. Who his
you talking about me?
No, not you. His philosophy was like, you know what? If this person comes in that situation, I know I'm gonna euthanize that pet the best possible way. I don't know what everybody else is gonna do, but I know in that situation I'm gonna do what's right for that pet. So that was his take on that type of situation. Is like, he knew they're gonna go somewhere else, but at least I know what I will do would be very humane. And so he would then that was his justification for working in that type of situation. I tend to kind of try to have a conversation with people. And if it's an animal that's been 12 years of age, and yeah, they haven't been to the vet in 7-8 years, 12 years of age, the client is perceiving the animal is suffering. We're going to have a conversation about it, and more often than not, they'll convince me that it's time. Because they're going to, because also maybe that's because of what that other veterinarian said to me. They're going to go somewhere else and do it.
They're going to go somewhere else and do it.
And so I'm going to have a conversation with them. Maybe I convince them not to. Maybe I kind of offer some services that might help their pet that maybe aren't financially constrainable, like an anti-inflammatory. There are a number of times I put them on an anti-inflammatory. They're better for another 6 months, and they do good, and they feel good, and the client's happy, and they know the vet's happy. But then after 6 months, the things start to happen again, the urination in the house, the pooping in the house, and they're not getting up as easy, and then it's time. So it's about establishing those relationships. Communication's key. Understanding what is going on, and sometimes you have every right to refuse to do that end of life procedure. It is. I think of it as a way of treating the pet and ending the suffering. And if I perceive that client has done the best they could to provide that patient quality of life for as long as possible, then that's good life. The pet had a good life,
So,
at the end of the day. I have to feel good about that the pet had a good life.
So yeah, this is you and I probably differ on this. So it comes down to sometimes patient suffering versus client suffering. And don't get me wrong. And I mean, we live in a society, this is the United States of America.
Really
this is the United States of America. And we have a very highly capitalistic system, which I'm cool with, all right? But over the years,
our profession wouldn't even exist without the capitalist system.
Yeah, we won't get into that. But over the years, what's evolved is we definitely have this attitude. We definitely have this attitude, customer's always right. Customer's always right. So when somebody comes into your practice, is the customer always right? And they're not. As a matter of fact, I
don't have that.
I
don't have that level.
either.
We're
Because
not at that
we're not
level.
selling a product. We're not selling
I'm not
clothes.
selling
No,
a
like,
product,
yeah.
but at the same time, if the customer's always right. Okay, so listen, we have been educated. We've been given a doctorate level of education, which a doctorate is just it's just a title that says, hey, look, you have a level of expertise.
Man, we are
and you can do
generating
these things.
lots of content worth of
We-
other
we-
episodes.
We got, so,
I mean, let's
stem
talk
off
about
of this. But that's
what a
our
doctor
level.
means.
And also when you have a client that comes in and basically, doc, hey, listen, I'm sorry, our dog's 10, done. It doesn't get around that well. We don't want anything. We just put the dog to sleep, period. And I agree with you. A part of me always looks at that and says, look, I could send you up and down the road. They'll probably just do, quite honestly, I don't think a very humane euthanasia.
Yeah,
Probably not.
very comfortable in how we do it.
I can do a better job of that. But at what point do I say, I do not want to be the doctor that everybody who comes in and says, sirens in the background, hey, listen, put my dog to sleep. This is what I want to do. I'm not here for your opinion or anything. My God, that is what I'm here for, is my opinion and everything. And no offense to that person, but they are more than welcome to go somewhere
Which
else
is
so that I can live with myself.
one of the reasons, hopefully,
which is
this
selfish,
episode
and my
No,
staff
gets
with them.
out there.
I agree
So
with that. I have no qualms in turning away
educate
someone
people.
saying that this is a viable pet, that if you just did a little bit, if you just invested a little bit into this animal, you could probably have a good amount of time.
But
There's nothing wrong with saying that an assessment
yes,
needs
of course,
to be made at the time.
of course. But there's a point in time where they're just not going to do it.
Oh, well, yeah. I mean, I think
And-
it's very case by case.
And are they going to just surrender their animal to a shelter,
Yeah.
or are they going to, is that or God forbid, try and use a rescue?
See, that's
like
what comes
actually
up.
put some effort
So,
into it.
Is it up to
You know-
you to cover for their lack of compassion and care for their own pet? Look, somebody comes in. Bottom line is, the reality is honestly, I never cared that much about this pet. I want to put it to sleep. Doc, do it. It's on
So
you.
you're
Whatever
gonna-
moral issue you have, I don't
So
care.
you
do
should
it.
go ahead and take that pet in and maybe find a home for it, right?
Oh,
You should-
so you're gonna are
Hey,
you gonna serve as an orphanage
That's
for
a
every
whole-
pet
that's-
yeah, that-
especially if they're sick.
It's like, let
Okay,
me offer
so
this
as
up to you.
I represent the bottom
Yeah,
line here.
let me offer that up to you.
Every sick
No.
animal has got a problem
No.
because then you got to find a home for it, and then you got to ask the people, "Hey, I appreciate you adopting this pet. By the way, it's got a plethora
got
of physical conditions and illnesses that you're going to have to make a significant financial burden for, and support that."
I'm going to just say, in my practice right now, and like in fact, probably for the last 20 years, like the practice we practice out, it is a rare situation for me to be so challenged like that. Oh my gosh, I've got to refuse euthanasia.
Yeah,
because
you're in a lucky spot though.
this
You're in
is-
a lucky situation.
And that happens to other vets. The other vets are in that situation a lot more than me.
Yeah.
But I am rarely in that situation. Most of the clientele I have are educated people that care about their pets,
Yeah.
at least to a degree, often very significant. But that it's almost always for me like the animal is there. There's a perception of suffering going on, and
Right.
we cannot reasonably resolve that. And so then that is the time to end. And it is almost always animals that have lived a long
Beautiful life.
Yeah,
And
It's
that's-
almost,
that's a-
unfortunately, sometimes it's a short life, but it's a severe disease.
Yeah.
So
100% agree. 100% agree.
I rarely run
Okay,
into
so
I
what I'd
rarely
like
run
to
into
do-
the
hold on.
convenience
I want you to make a
euthanasia.
quick point.
The
because we're coming
convenience
to an end.
euthanasia, I agree 100%. I do not do convenience euthanasia.
And that's where I come in and all. And some of these
Convenience.
are.
I had a client once that didn't want her poodles anymore because it didn't match her carpet and wanted to euthanize their poodles because they didn't match the carpet.
That's just embarrassing.
And I said, no, well, I'm not doing that. But that happens. But that was like 20 years ago plus.
Okay. Final thoughts.
We could go on forever.
Yeah, that's where you're just going.
Final
This
thoughts.
Sazerac
Should we
was
go on
excellent.
forever?
Sazerac was excellent.
Final thoughts,
It
doctor.
was classic Sazerac.
Um,
Very good.
Listen, you both are just amazing doctors in how you think about your pets and how you think about your clients and your patients, of course. So, Those are all, they become very moral issues at this point, and we have to make decisions that we don't like to make on the fly. Sometimes it's great, sometimes it works out.
But that's what you have to do. You have to get in there and you have to do that.
It's the tough decision making that you guys have to go through. As practice managers, we support and we help manage all of those things with the technicians. Sometimes it's hard for the technicians to watch you make the decisions you have to make, and they have to get on board.
Because most technicians are very pet centric.
Very pet centric, and so, but it's a beautiful magic that we have to make in our clinics.
Yes.
And it's a fine balancing act, but it's a passion.
Yeah.
It's a passion, and so we're lucky people to be able to be involved in this practice. It's hard to do, and it can be very emotionally.
It's often very rewarding as well.
Yes, draining, emotionally draining.
It is a tough field. It's becoming tougher. We are experiencing, understandably on my end, shrinkage of our...
I sense a segue into the next conversation.
Yeah, our profession is shrinking. Oh my gosh, what does that mean? What does that mean for availability of pet care, affordability? What happens to...
So many things to talk about.
It's not even just pet care, it's quality pet care.
As this shrinks, because nobody wants to go in this profession anymore.
You get these quick, just come in and get vaccines and get out. That's a lot. There's a lot of that coming up.
We're bringing up a lot of interesting topics for discussions in this particular podcast. Or
you're going to need to stay tuned to find out.
Yeah.
We're gonna go down the rabbit hole.
We're going to keep going.
I don't think we can stomach enough drinks.
We get to drink the drinks, but you get us drinking.
And you get a lovely beverage to go on with this conversation, which is great. So anyway, thank you guys. This has been so awesome today.
Yes.
Appreciate you taking this time out for today.
Lots of fun. This is probably
not always going to be outside with all the sirens and planes and
sorry about the noise.
And all the rawness,
leaf blowers, and whatnot.
And then also, I think this is a different take. We're honestly not so much talking about, though we may cover these things, the specifics of what to vaccinate for, when to vaccinate.
I think we should do those too.
We'll get there eventually, but this is more the raw, behind-the-scenes stuff that I think that never gets discussed and presented to people.
But I think
that's the purpose.
But I think those things too are really good.
Stay tuned.
Those are easy peasy. Easy peasy.
They're not easy peasy. Vaccines are not easy peasy.
Easier than
Click
this.
the button, subscribe.
All right.
Thank you so much for tuning in. We appreciate
you.
Thanks, everybody. Have a great night.